For doctors, getting information quickly can help save lives. So having the most reliable network really matters. Verizon lets them monitor patients at home and use real-time video to consult with colleagues. Keeping patients healthy is what drives doctors. Being their partner drives us.
Hi, I'm Kat Jersich, Senior Editor at Healthcare IT News. Thanks so much for watching Telehealth Connection TV, brought to you by Verizon for HIMSS TV. Here with Dr. Karen Abrashkin, Medical Director of the House Calls Program at Northwell Health. Dr. Abrashkin, thank you so much for being here with me today.
Thank you so much for the invitation.
So let's just get started with you telling me a little bit about Northwell's home-based primary care program model and who it's serving.
Sure. So Northwell Health, as you probably know, is a very large integrated health system, and our home-based primary care sits within that system, really caring for the sickest patients in our community, those who are homebound, have multiple chronic conditions, generally who are advanced age, and most of our patients have had past year hospitalizations prior to enrolling in the program.
And so how did you incorporate telehealth into this program?
Well, that's a great question. So we've had a long journey with telehealth going back to 2018. Our program really started with telehealth thanks to a grant that we got from the West Health Foundation. We started with a direct-to-patient pilot back in 2018 and had a very difficult time with that. At the time, we had a very low uptake rate. We had a lot of technical difficulties that we encountered, but certainly learned a lot from that pilot. We actually moved into a facilitated telehealth model from there, where we were able to use EMTs as telehealth presenters and really take all of that, all the technical requirements off of the patient and the caregiver and have the EMT take over all of those so that the patients could just interact with their primary care provider using telehealth. And after that, once COVID hit, and New York, downstate New York was really at the epicenter of the COVID pandemic starting in March of 2020, we shifted back to our direct-to-patient model, this time with a much different outcome, with a much larger number of patients utilizing telehealth, largely through their caregivers, both family and paid caregivers, but it was a much different climate, and we had a much different outcome.
And so I want to go back to some of the technological challenges that you faced with that initial direct-to-patient model. How did those change during the COVID-19 crisis, and what changes were you able to make that more successful?
So there were a couple of changes on kind of the technology side, and then there was the whole environmental change. So on the technology, when we had initially rolled out this application, we thought that it was going to be an application that was compatible with all different devices. It was actually the health systems application wasn't too widely used at that time. But we found out pretty quickly that it actually didn't work on Android devices. So we had a large number of our patients who were trying to connect through Android, were not able to. We actually had some patients who went out and got non-Android devices just for this pilot because they were so motivated to participate. But a large number of patients couldn't do that just financially and technically. We also had some challenges on downloading the application, even when somebody had a compatible device, because people couldn't, we were surprised. People just had that basic barrier of not being able to remember their Apple ID, not knowing how to download an application, because our patients are quite, they're older adults, average age of 86. And so, the way that things changed during COVID was that, first of all, the application evolved. It was much more device agnostic, much easier to use for our patients to download it. And then the whole environment changed. Suddenly we were in this environment where any kind of face-to-face contact just had a very serious conference of risk. Just everything that we had really built our program and our relationships with our patients on suddenly was, a danger for COVID transmission. And so patients and caregivers, kind of where there's a will, there's a way, and they were really able to come together. Sometimes even neighbors would go help our patients using iPhones or other devices that the patients didn't have. Sometimes paid caregivers allowed their devices to be used, whereas they weren't so interested in doing that previously. So we had a big shift both in terms of the progression of the application and then in terms of the environment that our patients and caregivers were in.
That's great. So switching over to the provider side a little bit, what kind of training did you give providers in terms of the best ways to give patients care via telehealth, both in 2018, 2019, and now?
So we've had a couple of different iterations of training. So the Northwell Health system has a large EICU. And so we would send our providers initially out to the EICU to receive training there. We would provide some web-based trainings on best practices, both through the health system and externally. And then once COVID hit, we really needed to get people trained very quickly, and we could no longer, of course, send people out face-to-face in the EICU. So we started using essentially train the trainer, people who had received training. We're giving tips, we're giving pointers. We had lots of frequent check-ins with our providers to troubleshoot problems, almost PDSA cycles daily on telehealth and web-based etiquette, troubleshooting the application, talking about things regarding etiquette, even things that are as simple as holding your ID badge up to the camera so that people can see who you are, what types of clothes to wear so that you're not distracting on camera. So really basic things to also the technology side, how to troubleshoot the application if the patient or caregiver can't get on, what are backups if kind of ideal version doesn't work, what to go to second, third, fourth line. And so a lot of learning from each other during the pandemic, certainly.
If I can ask one follow-up question, can you walk me through what the workflow looks like if you do run into technological hurdles with that first app?
Sure. So if we run into problems with the first app, we have a couple of second and third line telehealth apps that we can use. So we kind of through group discussion, through trial and error, we found out what would be best for second, what would be best for third. There are always cases where we can't get any telehealth app to launch. And so in those cases, we convert to a telephonic visit.
Got it. I also wanted to ask, what about primary care in particular makes it such a good candidate for telehealth?
I think the thing that telehealth brings to primary care is a continuation of the patient and primary care provider relationship. You get a much better sense of the patient's patient's face, how they're feeling, how their caregivers reacting and responding. It's a better way of connecting with the patient than we found the telephone to be. And a lot of primary care really comes down to the patient and primary care provider connection. So it's really allowed that to continue, even when we weren't able to see patients face to face.
Is there anything you want HIMSS TV viewers to know about the future of the program, or what you think other health systems should know if they want to institute a similar program?
Yes, I mean, I think we've had some real lessons learned along the way. One of those is that telehealth is never going to fully replace face-to-face visits because patients in advanced illness programs, as I said, our patients are an average age of 86. They have multiple medical problems. There's always going to be a portion of those patients who can't participate in telehealth. For those patients who can, it's been very helpful. So we will always have some telephonic and some face-to-face visits that are needed. And even those patients we're seeing via telehealth in our advanced illness program, it really doesn't fully replace face-to-face visits, but it certainly can augment care. It allows us another way to connect with patients. On the technical side, when COVID hit, we needed to very rapidly consent large quantities of patients. About 1,500 patients we needed to consent for telehealth, get set up with the application, provide training. One of the ways that we got that done was by utilizing administrative staff to consent patients and to provide training. Each time that our administrative staff reached out to a patient or a caregiver, it took about 20 to 30 minutes to obtain consent and to provide adequate training and do a test run on the telehealth platform. So taking that off of our providers allowed them to really just focus on the patient care when they got onto the visit. They didn't have to troubleshoot the application nearly as much as they would have had it not been done by our administrative staff previously. So having a very defined workflow around who's obtaining consent, who's training the patient, what does the provider do when they get on the phone, really allows the process to go as smoothly as possible.
That's great. Thank you so much again, Dr. Abrashkin. This has been a wonderful conversation, and I really appreciate you coming on with me.
Thank you. It's really been my pleasure.
Thanks so much for watching Telehealth Connection TV, brought to you by Verizon for HIMSS TV.
For doctors, getting information quickly can help save lives. So having the most reliable network really matters. Verizon lets them monitor patients at home and use real-time video to consult with colleagues. Keeping patients healthy is what drives doctors. Being their partner drives us.